Today, we are going to demonstrate how to assess the breast properly. The purpose of this assessment is to evaluate the use of correct techniques in performing a thorough physical assessment and to differentiate normal from abnormal findings of the breast. The materials needed for this assessment of the breast are centimeter ruler, small pillow or rolled towel, gloves, client handout for BSE, a gown, and a floor specimen. The steps on the assessment of the breast. First, perform hand washing. Gather the materials needed. Then explain the procedure to the client. And then ask the client to put on a gown. Now, we are ready to assess the breasts of our female patient. Inspect the breast for its size and symmetry. Inspect the breast for its color and texture. Inspect superficial venous pattern. Bilaterally, note for color, size, shape, and texture of areolas. And bilaterally, note for size and direction of nipples. In inspecting for retraction and dimpling, we need to ask our client to remain seated, then ask the client to raise her arms overhead. Then ask the client to press her hands against her hips. And press her hands together. Then ask the client to lean forward from the waist. After inspecting the breast, we are now ready to palpate the breasts. So in palpating the breast, we need to ask the client to lie down and to place the arm on the same side as the breast being palpated. Then place a small pillow or rolled towel under the breast being palpated. And in palpating the breast, we need to use the flat pads of 3 fingers to palpate the client's breasts. Palpate the breast using one of the 3 different patterns. First pattern is the circular pattern. Another pattern to be used in palpating the breast is the wedge pattern. Pattern to be used in palpating the breast is the vertical strip pattern. Palpate every square inch of the breast from the nipple and areola to the periphery of breast tissue and up into the tail of spines. Vary the levels of pressures you palpate. Use light pressure to feel the tissue closest to the skin. Then use medium pressure to feel deeper and firm pressure to feel the tissue close to the chest and ribs. Palpate the breast for tenderness and temperature.
Mom, can you feel any pain?
Palpate for masses. And in here, we need to take note for location, size in centimeter, shape, mobility, consistency, and tenderness.
Mom, may nararamdaman kayo? Can you feel any pain?
Then palpate nipples by compressing nipple gently between the thumb and index finger. Then observe for discharge. Nipples by compressing nipple gently between thumb and index finger. Observe for discharge. At this moment, we are to palpate the breast of our male patient. So we need to inspect and palpate the breasts, the areolas and nipples for swelling, nodules, or ulcerations. And now, hold the elbow with one hand and use the 3 finger pads of the other hand to palpate firmly the axillary lymph nodes. Palpate high into the axilla, moving downward against the ribs to feel the central nodes. Continue down the posterior axilla to feel for the posterior nodes. Use bimanual palpation to feel for the anterior axillary nodes. Then, palpate down the inner aspect of the upper arm. and document findings.